What is your condition and what has been done to fix it?
Well, I have a heart condition, atrial fibrillation. And what happened at the beginning, when I first got the condition, it came on like a seizure. There are a lot of different types of atrial fibrillation. Mine is the type that once my heart triggers and starts going in a rapid heartbeat, it keeps going faster and faster and faster until I either take medication or have to go to the emergency room and get cardioverted, which is a sense of electrocuting your heart. And which cardioversion, what it does is it stops your heart and lets it begin again. And the natural reaction of your heart after it stops is to go back into a regular heartbeat. I went years after that thinking I was fine and that it wasn't going to come back. And about 10 years later, it came back again. But I kind of went a little bit of denial. I didn't really go to the doctor when I should have. And what ended up happening was I ended up getting chronic atrial fibrillation. I would go into these seizures, but they would self-correct. After periods of time where my heart would be beating so hard and so fast, and I would start sweating, and I'd have to lie down. But I'd breathe deeply for a long time, and it would pass. But because I didn't go to the doctor, I ended up with heart failure from the chronic fibrillation. And at that point, when I was treated for heart failure, that's when they discovered that I had atrial fibrillation for the last few years. It was in a chronic state, and they gave me lots of medication, and they put me on a program to manage the situation. At least when I did go into what before would be a kind of a heart seizure, when I'd gone in that state, instead of going into a heartbeat that would be uncontrollable, where I'd have to go back to the emergency room again, I would go into a state where the drugs would take over and manage the heartbeat to such an extent that it wouldn't go so fast that I had to be treated immediately. After a period of time, those drugs as efficient as it was at the beginning. So once a year, I would enter into a situation where all of a sudden I'd go into one of these seizures. There were a couple times where I had to go to the emergency room and ambulances. I started researching what was going on, and I started asking Kaiser if they would do what's called an ablation operation on me. And what an ablation operation is, when they go in and they burn off the nodules that are causing the atrial fibrillation. They try to reconstruct your heart through, basically burning off the different parts of your heart that are really not behaving. So I started applying for that operation, and they kept telling me it was still in experimental stages and they didn't want to do it. They kept telling me that it was better just to take the drugs and manage my heart. As each year went by, from about 2001 to 2008, I guess I had my electrocardioversion maybe 5 times during that period. But in 2008, I finally ended up in the emergency room twice. At that point, I think they realized that they're spending so much money cardioverting me that it was better for them to actually just go ahead and spend the money and give me the heart operation. The surgeon told me it took something like 2 to 2.5 hours, burning every nick and tuck of my heart to make it conform to where I might possibly get to go the rest of my life without another seizure. The only problem is I have had many seizures, but because of the operation, when I do get a rapid heartbeat now through the atrial fibrillation, my heart has the capability of correcting itself like most normal hearts do. So far to date, 5 years later, after the operation, my heart, when I do have the little mini seizures, my heart does self-correct.
What are the main reasons for your condition?
That it's primarily a genetical situation, the type of atrial fibrillation I have. My mother has three brothers, and they all died of heart conditions. And it was so long ago that it could have been atrial fibrillation for all we know, because during the period of times that they died, atrial fibrillation was not really being dealt with like it is today.
What is the most significant way in which your condition impacts your daily life in terms of how your body functions?
The most significant way my condition affects my daily life is that I was ordered by my cardiologist to spend a lot of time in the gym. If you live a sedentary life, you run a high risk of having the same thing come back even with the operation. In other words, the operation has to be done in conjunction with managing your heart in a healthy way from there on out. So ever since then, I basically have run or done the treadmill or whatever at the gym or run at home in order to kind of doing my half of the management of my heart. And what I have found is where I slipped into situations where I wasn't able to do much cardiovascular activity, I've noticed a higher incidence of irregular heartbeats and little mini seizures, which remind me that I have to definitely get back in the gym and start doing cardiovascular again. So it's something that I think about day to day.
Has your condition heightened your awareness of how your body functions, and if so, in what ways?
In the morning, I can tell when my blood pressure is up or when it's normal or when it's low. At night, I can tell when I'm tired that I'm more susceptible to an irregular heartbeat. The later I go to bed, the more likely I am to have irregular heartbeats. I can feel them when they happen. I know when they happen. You become very aware of your body and how your heart affects it day to day.
Who has been most important in helping you to understand your condition and its impact on your body function?
The number one person was my cardiologist, because my cardiologist laid out the roadmap to managing my situation. Without the roadmap and without the instruction and without the cardiologist explaining what had to be done and why, I most likely would have fallen back into the kind of the same situation I was in before.